It's time now for Medical Moments with Covenant Healthcare, and joining us this morning we have Julie Barrett and Nicole Brookman. We appreciate you being here, talking about something that can be very scary, sudden infant death syndrome, or SIDS, and also some safe sleep practices for babies. And we should start by kind of explaining what SIDS is.
Yeah, the two kind of go hand in hand together, but SIDS is the unexpected death of an infant under the age of 1. So once an investigation has been done and there's no obvious cause of death, it's classified as SIDS. It is one of the leading causes of deaths in infants.
I didn't know that.
Yeah, and it is, it can be really scary, you know, for parents, and bringing home a baby. It's usually on the top of their mind.
What are the risk factors, if you will?
So risk factors include not placing baby in a safe sleep environment, which Julie will get to, or safe sleep surface. There are some prenatally some things that can change, cause SIDS. That can include low birth weight at birth, not getting early prenatal care. Also not getting those immunizations can have a higher risk of SIDS, and babies not receiving any human milk. Actually receiving human milk can decrease that risk by 50%.
You're kidding, I've never heard that.
Yeah.
Wow. That's interesting. How can parents really prevent a baby's risks of getting SIDS?
So really that first 6 months period is crucial. They're going through a lot of things developmentally, so making sure that you're going to all of those health or those appointments for babies, making sure that you are placing them in that safe sleep environment and the safe sleep surface, and then just, if you can, make sure you try breastfeeding or providing that human milk. That can help as well, and room sharing, but not bed sharing.
We want to ask too, what can we do to protect our babies in a physical sense, in the house?
Yes, so again, put them in a safe sleep environment. You want to put them on their back, not on their stomach or side. You want to share room, but not the bed. You want to put them in a bassinet, crib, playpen. You want to make sure that the temperature is between 68 and 72 degrees, so that you're not overheating the baby. You also, if you plan on drinking or taking any drugs or taking any sedatives, make sure that you have a provider, take them to a provider that you trust, that can keep an eye on them, so that way they are in a safe place. Also, I do encourage like pacifier. So if don't force a pacifier, but pacifiers help prevent sudden infant death syndrome as well. So those are some things that you can do. Also, make sure that you are not using your swings or car seats as a place to for the baby to sleep, because that can it can hinder their oxygen supply. So we want to make sure that, you know, if you're tired, you know, if you're taking any alcohol or drinking any alcohol, drugs, or anything, just make sure that you have them in a safe place area. Make sure that if you're tired, put them in the bassinet, the bed. Don't sleep with them. Sleeping with them can cause suffocation and get caught up in between the bed, and you don't want that to happen, bed and the person. Those are some things that you can do to prevent.
What is the advice on blankets?
So blankets, yes. So you don't want to put blankets or any soft stuffed animals in the crib. That can cause suffocation. They can get caught up in the blanket in the crib. Put them in a sleep sack, we prefer sleep sacks. They are the safest. So sleep sack or a onesie, put them in a onesie. That will help prevent them from suffocating or getting caught up in the blanket. You also want to put them on a firm mattress, tight-fitting sheet. Around the mattress, you don't want any bumpers around the mattress as well. So you want to make sure that you keep everything out of the crib except the baby.
This is so useful and very interesting. And what's the overall goal here when it comes to talking about SIDS and really raising awareness and keeping babies healthy?
So the overall goal is to prevent infant sleep-related deaths. So some of the things that you can do is educate caregivers to adopt practices that will significantly decrease the risk of sudden infant death. You can also you want to make the community aware of safe sleep practices, especially in the areas where there are higher risks for sleep-related deaths.
Interesting. And what resources does Covenant offer really for safe sleep education?
So we do have safe sleep education on our website. We also provide all patients with a sleep sack to go home with after they deliver their babies. So we really encourage the use of those. We use them in the hospital, and then they're also given one to go home with as well.
Wonderful. All right. Well, that is so, I'm learning so much here today. We appreciate you being here. And if you want any additional information or a link to get to the Covenant website, just go to Hot Links. It's at the top of WNEM.com, or you can also use our mobile app.